Dr. Rajesh Patel. Dr. Patel, good afternoon, and thank you so much for joining us.
Good afternoon, Anati, and good afternoon to your viewers as well.
Dr. Patel, perhaps let's start here. As the representative body of medical schemes, please can you update us on what you have observed in terms of the taking up on vaccines from medical aid members?
I think that because medical schemes are predominantly in the urban area and they probably understand what's the disease about, the benefits of the vaccine, there is significant take-up of it. However, what we have noticed from some of the data presented by the Department of Health, that quite a number of people are actually not taking up, particularly now that more and more younger people have been allowed to register and get the vaccine. I think the example is in the case of the elderly. We believe that potentially 30 to 40% of the elderly have not yet registered or not yet received their vaccination. Now, this is a very high-risk group that's obviously very worrying. And to us, the more people that get vaccinated, the closer we get to that point where we can get back to normal activity. If we look at three examples, measles, polio, which is mostly eradicated around the world, smallpox, which is absolutely eradicated. And the main reason for actually eradicating most of those conditions has actually been vaccination. And it shows the potential success stories that if we do vaccination and we do it on a mass scale, we can actually achieve the kind of desired results we want.
And Dr. Patel, those results essentially speak to the 67% target of herd immunity. Now, with your concerns that you're raising now, what are some of the effects that we would reach that 67% target of herd immunity? I know that we're talking about 40 million people essentially being vaccinated by 2022 around March.
Yeah, I think it can be done, but perhaps we're not necessarily doing everything that should be done. Remember the start of the program, we started vaccination sites in sort of central places where people can go to, but those people that got transport, etc., would go to those areas. One of the critical components now is that while a lot of people who wanted to get vaccinated perhaps has got to that, we need to now think of different options and rather go to the people. And I think one of your previous persons that you interviewed also made comment of that, is that perhaps now the strategy should change a little bit, is that while we continue to run these vaccination sites, perhaps what we need to do is to start getting decentralized and we start sending perhaps the nurses or teams out to the community. A big success factor has been those employer groups that are registering their members in mass and their vaccination is taking place at the place of employment. Mining industry, for example, is an excellent example of the success that they're managing to achieve. And this is largely driven by the employers out there. I know in the motor industry as well, there's a lot taking place at the occupational health centers. And what we need to potentially do is to get more and more of the employers to get on board and perhaps engage with the representative bodies, etc., the Business for South Africa, etc., find out more information, register their staff en masse, and perhaps organize events where these nurse clinics, etc., can come to their premises and get staff vaccinated. I think the important thing is, yes, younger people, when they do get the disease, it's more milder, but the older ones tend to have more severe hospitalizations, the deaths, etc. So it's critical that the 30 to 40% that have not been vaccinated, we start getting to them. And perhaps they might be in the outlying areas and things like this, and the community health workers, the teams, that can be useful. But one of the things, and I noticed the biggest gap, is while national government seems to be doing a lot of communication, it may not be filtering out to the community level. And we need to get community civic organizations to be more active. There's a few people who are spreading sort of negative views, but the majority are not against it. And it's time the majority starts speaking up about it. We need to get municipalities kind of thing to start getting people together, having these civic meetings, civic center meetings, etc., and really spreading the word at the ground level. that there's really more success and more benefit out of the vaccination than the few side effects that may have been reported. And I think that's critical for us to dispel any of those other misinformations that are out there. Yes, there are some people who have a negative view about vaccines, and their personal beliefs is they won't be taking it. But I don't think that some of their views should sort of prevent the rest of the population from getting clean information and taking informed decisions about getting their vaccinations done. And the more people that get vaccinated, the more safer we as individuals will be, but more the community will be. And for every person that doesn't take the vaccine, more than one person becomes at risk of getting the disease or being exposed to the disease. And that's what we need to overcome, is that more vaccinations, more we'll overcome the disease, and we'll probably have success like smallpox, measles, polio, etc.
Dr. Patel, you've addressed then the misinformation that you say is probably, relating or, just exacerbating the vaccine hesitancy that we are seeing in the country. Talk to us then about the reports that we are hearing that unvaccinated medical aid members may have to pay higher premiums than vaccinated members. Why is that? And in fact, can you confirm that?
No, I think that's another example of misinformation. The Medical Schemes Act is very clear. The regulations are very clear. The regulator is on top of what they're doing. And there's not a single medical scheme that I'm aware of that has said that they will charge extra. I have heard through the market about insurance companies perhaps adjusting their premiums in a way that if you haven't vaccinated, any new policy sold, you will end up paying a kind of a excess premium on those applications. But that's in the life insurance industry and not in the medical scheme environment.
All right, Dr. Patel, thank you so much for your time this afternoon. Really do value it. That was Dr. Rajesh Patel from the head of Benefit and Risk at Board of Healthcare Funders. All right.